Atherosclerotic disease is when you have plaque of your coronary arteries. And if you get enough of that plaque, it starts to actually occlude the coronary artery. You have 3 main coronary arteries that feed the heart. So if one of those is occluded, the other 2 have got to pick up the workload and try to perfuse that heart so that it will squeeze effectively and eject its contents. So in atherosclerotic disease, once you have more than 70% of a coronary artery occluded, you not only make the heart struggle for oxygen, you lose the auto-regulation, the ability of the aorta and vessels to vasoconstrict and vasodilate to improve blood flow. So people don't do well when they have blocked coronary arteries. That is what happens in what we call a myocardial infarction. The coronary artery gets completely occluded, and then there is no blood flow distal to that coronary artery. The most common myocardial infarction or atherosclerotic disease that leads to someone coming into my unit is when they infarct the anterior part of the heart. So the anterior part of the heart feeds the left ventricle. The left ventricle is the ventricle that needs to be strong and amply ready to eject all of its contents out into the circulatory system. So if it's unable to do that, then we're not giving blood flow to the body. And the body is not happy. We talked about the kidneys, we talked about the liver, we talked about every organ in the body that needs blood flow. So we need to figure out ways that we can augment that. One, we can take a patient into a cath lab and we can open up that artery, and then we get better blood flow. But even when you open up that artery, sometimes the part that was not getting blood flow, that heart is very sick, is sometimes unable to accept that blood flow and therefore can't perfuse even after we've fixed the atherosclerotic disease. So we use at the bedside, we use a couple devices that we can augment that cardiac output so the heart doesn't have to work so hard to get the oxygen and circulate it. One device that we use is something called a balloon pump, or I should call it intra-aortic balloon counterpulsation. That's a mouthful, right? And it's a misnomer. It's actually not a pump. There are certain devices that we call ventricular assist devices that are actual pumps in the left ventricle that suck out its volume and push it into the aorta. That's an actual pump. The balloon does not do that. What it does is displaces volume. So volume that does get ejected out into the aorta. The balloon, which sits in the aorta, is fed through someone's femoral artery. It goes up their aorta and sits. It would normally be a little bit curved right over here. And we time it to inflate during diastole, the resting part of the heart. That's when the coronary arteries are perfused during diastole. So if the heart's not able to perfuse real well because the coronary arteries are blocked because of atherosclerotic disease, we can say, well, we'll help you. Whatever volume you get out, we're going to inflate the balloon during diastole and push that volume back to the coronary arteries and allow it to sit there for a few moments to allow extra oxygen to be supplied to the heart muscle. And then during systole, the balloon deflates to get out of the way for the heart to be able to eject its contents. When it deflates, it actually causes a negative void in the aorta, which decreases the resistance that the next heartbeat has to work against because it doesn't sense all that high pressure. And also when it deflates, it sucks the stroke volume out because a heart that's failing or has terrible atherosclerotic disease is unable to generate a good power or cardiac output. And therefore it doesn't get down to the toes and the legs. And so the balloon pump helps push it down to your very distal capillaries. So if you don't have very, very good native function, if the heart has been impaired so much that all coronary arteries are blocked, we need to go forth and do even more invasive things. One, open heart surgery. Two, we have another device that I don't have here to simulate for you today. It's called an Impella device, and that is a ventricular assist device. And it has a motor sitting in the left ventricle and will suck it out and spit it into the aorta for you and can truly augment cardiac output and unload the heart, allow it to have better oxygen, and decrease its workload. And therefore we fix the atherosclerotic disease and then also in that time help augment the heart for its recovery and restful phase.